Hi everyone! Today we're going to be talking about critical literacies in action. Specifically, our focus is going to be on the psychosocial and environmental literacy that is a part of the CLAM model. Our topic is burnout and balance, understanding the self to build resilience. The purpose of critical literacies is to help learners develop practical literacy skills that will lead them to making informed decisions, changing behaviors, and influencing actions that will help advance positive social change. The Critical Literacies Advancement Model has identified 5 major literacy categories in adult learning: foundational, sociocultural, human and social justice, psychosocial and environmental, and technological and informational. For this workshop, we will be diving into the psychosocial and environmental literacies. These literacies include health, emotions, food, finances, civics, and environmental literacies. Our specific focus will be to discuss health and emotional literacies in relation to burnout, with the intent to provide employees and employers with tools to promote health and emotional well-being within the workplace. Burnout is a work-related mental health condition that can severely impact productivity, employee morale, retention, and overall profitability of an organization. Following the CLAM model, we've designed an adult learning workshop geared towards the identification, prevention, and course correction of burnout in the workplace, and how to provide employees with a desirable balance of emotions, workload, and stress factors. The purpose of this workshop is to define burnout symptoms, and the effects it has on employees in the workplace, identify areas of opportunity to reduce and/or prevent burnout, provide tools and mechanisms for employees to cope with, manage, and prevent burnout and declining health, promote mental health, physical well-being, and work-life balance, and increase employee retention and satisfaction. Upon completion of this workshop, attendees will be able to identify and understand the emotional and psychological signs of burnout, reflect on personal stress triggers, past experiences, and develop coping mechanisms, explore ways and tools to build emotional literacy and mental resilience, develop and implement a personal burnout prevention or self-care action plan, and utilize company-provided benefits to help prevent and manage stress and burnout. Let's talk more about the theories and concepts of burnout. Although burnout does not have a single agreed-upon definition, there does appear to be a consensus about the dimensions that play a role in it. The 3 dimensions have been described as emotional exhaustion, which is characterized by emotional depletion or loss of energy, depersonalization or cynicism, which is described as dehumanization, detachment from work and clients, or emotional hardening, and reduced personal accomplishment or inefficacy, which is a feeling of personal or professional inadequacy, as well as reduced productivity and coping skills. Of these 3 dimensions, emotional exhaustion is believed to be the core component of burnout because of the impact it has on an employee's well-being in the workplace. Many studies have shown that there is consistent association between emotional exhaustion and unfavorable psychosocial working conditions such as high workload and low social support. When the concept of burnout was first introduced, the association between burnout and work was very clear. Now, researchers have decided to break this down even further by trying to determine exactly what factors in the workplace can contribute to feelings of burnout. According to the European Foundation for the Improvement of Living and Working Conditions, there are 8 key determinants that influence burnout: stressful, emotional, and tiring working environment, conflicts in the workplace, social support from colleagues or lack thereof, physical aspects of the work environment, intense workload and working hours, autonomy, teamwork, and growth opportunities, impact of management, and implementation of a reward system. Feelings of burnout can influence multiple aspects of an employee's life, including but not limited to their mental health, physical health, job satisfaction, and job performance. Mentally, employees that are experiencing burnout may face increased levels of stress, anxiety, and depression. The key difference between burnout, anxiety, and depression is that burnout is directly associated to these feelings within the workplace and can often be reversed if the stressor is managed appropriately. Physically, burnout has been linked to headaches, hypertension, insomnia, and in more severe cases, cardiovascular diseases such as coronary heart disease. In the workplace, burnout is often associated with a decrease in employee commitment, job satisfaction, job performance, and motivation. Additionally, feelings of burnout tend to increase the number of absences in the workplace and contribute to higher levels of turnover. Instead of being reactive when employees begin to express feelings of burnout, it is important for organizations to offer proactive strategies that assist with managing burnout. Research studies have shown that there are 3 types of intervention programs that are effective: person-directed, organization-directed, or a combination of both. The goal of person-directed intervention programs is to equip employees with interpersonal skills that will allow them to manage their stress, build resilience, and increase their productivity in the workplace. Person-directed intervention programs focus on empowering employees with the appropriate skills needed to tackle burnout, while organization-directed intervention programs focus on the workplace itself. The sources utilized for the content and development of this workshop include peer-reviewed articles on adult learning and the role of prior experiences, data analysis of burnout in the workplace and policy responses, implications of burnout on mental health, study of physical, psychological, and occupational consequences of job burnout, burnout prevention literature, and studies on the impact of psychosocial training on burnout, engagement, and resilience. Burnout can be experienced by any employee regardless of their seniority level, tenure, and specific position or demands of the job. Identifying, addressing, and preventing burnout benefits employee health, performance, retention, experience, productivity, and overall profitability of an organization. The following contexts could be indicators of a need for burnout and balance workshop: increase in employee absence due to illness, mental exhaustion or fatigue, decreased productivity and low employee morale, low engagement scores from team members, surveys regarding quality of life, work-life balance, and job satisfaction, increase in turnover and voluntary resignations due to health reasons, or increase in usage of mental and physical health company resources and benefits. If you notice any of these occurring within your workplace more frequently, a burnout intervention program may be useful. One activity that could be used during this program is a stress and boundaries workshop. This hour-long workshop is designed to educate employees on stress and boundaries. The session is comprised of an explanation of the concepts and open discussion with role-playing scenarios related to stress and burnout and how to handle such situations. Ideally, this would be held in an off-site location that is a relaxed environment and will allow participants the opportunity to break away from their usual environment. To complete this workshop, you will need stress management checklist that will be provided for the participants to take home and keep, scenario cards printed out that has real-life situations for practice on how they will handle the situation, and additional resources and materials for company-provided benefits to help manage stress and burnout. Another activity that could be useful is an info session about burnout and health. This activity will give participants an in-depth overview of the negative health effects that burnout has on physical, mental, and emotional health. The purpose of this info session is to create awareness of such effects and provide tools, techniques, and recommendations on how to identify, improve, and prevent such effects. This would be held in a meeting or conference room that is set up to include seating and tables for all attendees. Required materials would include an expert guest speaker on negative health effects of burnout, projector screen speakers and videos, and printouts with information and health recommendations. If either of the 2 previous strategies will not work, you could also consider doing a mini release session. This activity will instruct participants on how to carry out a stress release exercise. The participant will write down what is causing them stress, causing them to feel preoccupied, or anything that affects their mental state and productivity. Ideally, this would be held outside in a quiet and safe open space that is free of distractions. Required materials would include a journal and writing tool, headphones if needed, and colored dots for emotional check-ins each day. The purpose of this evaluation plan is to equip adult learners and employees with the knowledge to recognize the signs of burnout, foster a workplace that minimizes its occurrence, and understand both the short and long-term benefits of proactive burnout prevention. It also aims to provide a clear understanding of what burnout is and how it can impact overall workplace performance and well-being. To evaluate our express goals from the training, we would implement 2 Kahoots with the same questions, one being presented at the beginning of our training and the other being presented at the end of our training. The questions in our Kahoot will be subheaded with each one of our goals, our critical literacy, and our key terms and concepts so we can measure which specific topics learners are grasping. The last couple of questions in our Kahoot would be scenario-based questions so we can not only measure if they understand the content, but also measure if they can apply our content in a real-world scenario. These 2 Kahoots will let us be able to measure how much everyone has grown in knowledge on burnout by measuring our subtopics on what they knew coming into our training versus what they knew when they left our training. At the very end of the training, we would have the participants fill out a Google form where they can rate and write feedback based on our training. The Google form would have ratings on things such as training effectiveness, relevance of content, would they feel comfortable applying the training in the real world, was the critical literacy easy to understand, an open answer section for what did we do well and what we can improve on, and an open-ended section for any other feedback they would like to give us. We would then be able to see how beneficial and effective the adult learners feel about our training and be able to adjust based on their scores and feedback. This training on burnout and balance emphasizes the critical importance of awareness of psychological and environmental literacies, which addresses the unique problems of adult learners in the learning environment. By incorporating the essential factors into training sessions, the participants not only learn to recognize burnout, but they also learn how to effectively prevent it through implementation of proactive strategies. Through raised awareness, capability development, and the culture of well-being, this training can help to support the development of a long-term and sustainable workplace. Our aim for this training is to foster resilience and a workplace culture of inclusiveness and support. The sources that were used to create this training are listed on our references page. Thank you all and have a nice day.